Many people come in and will say in the first consultation at the end, when they have had 5, 10, 20 minutes just being listened to, that they feel a lot better just having had the space to talk about it. Because very often it'll be the first time people have been able to open up honestly about it. A lot of people feel guilty about opening up in front of their family. A lot of people will say we don't want to trouble them, we don't want to worry them. People are really worried about worrying other people, despite the fact that they are anxious themselves. And I think that's what we've got to begin to break down. We've got to begin to break down people's worry about worrying other people. So I think the more that we can all accept as a society that sometimes people just need to talk, and all that we need to do is listen, then I think that will make a huge difference. Very often people worry about not knowing what to say, thinking, I can't help, I don't have any expertise. The reality is you don't need any expertise, you just need to be there. And sometimes you just need to sit and allow somebody, without judgment, without any sort of comment really, to just talk about what's worrying them or how they're feeling. And that is often quite therapeutic in itself.
If someone goes to see their GP with things like anxiety, depression, panic attacks, does it automatically mean that they're going to be given medication to help cope with those symptoms? And
No.
will it mean a long-term course of medication?
No, absolutely not. Of course, there are going to be some circumstances in which medication becomes the appropriate thing to do. And different doctors deal with things in different ways. But generally, the rule of thumb now is that there are multiple ways of handling and dealing with anxiety. The first of which is simply giving space to people to be able to express their anxieties. And as I've said, for many people, that's a good start, and they will often go home feeling better. And the chance to talk again is sometimes the only thing we need to give them. So we have counselling, we have anxiety management, both on a one-to-one basis and in group settings run by our community mental health teams. And that is essentially just a space to be listened to. It's guided, and so there are professionals there who can begin to help you feel and think differently about the way you approach challenges in your life. When you're feeling very anxious, I'm sure all of us have had this feeling, when you're feeling anxious for whatever reason or worried for any reason, when you try and make decisions, those decisions are often skewed by how you're feeling. So even if you have to decide whether I want to go to the shops or not, or, am I going to put the bin out, being very anxious is going to affect those decisions. So sometimes just having strategies in place to decide how best to make a decision when you're feeling worried is what you need. So sometimes it's just about that. Sometimes it's about self-help. So there are lots of online resources now that you can use in your own home. There are books that you can read. There are CDs that you can listen to on sort of relaxation and that sort of thing. So there's lots of stuff you can do yourself. In some cases, particularly because anxiety and depression are so closely linked, it is appropriate to use medication. And nowadays, the medication that we use generally is pretty clean, doesn't tend to sedate you, doesn't tend to be addictive. Lots of people are worried about that, and tends to be a pretty elegant thing to use. So it's sometimes right to do that.
We are with Dr. John